Hello and welcome to this video on understanding and managing hoarding disorder. In this video, we'll explore what hoarding disorder is, how it differs from normal clutter, and some strategies for managing this challenging condition. 1. What is hoarding disorder? Hoarding disorder is a condition characterized by persistent difficulty in discarding or parting with possessions, regardless of their actual value. People with hoarding disorder may accumulate excessive amounts of clutter, which can interfere with their daily activities, safety, and well-being. It's important to note that hoarding disorder is different from collecting or being messy, as it involves significant distress or impairment in functioning. Example: let's say you have a friend named Sarah who has a hoarding disorder. She has been collecting newspapers and magazines for years and has stacks of them in every room of her house. Even though they are outdated and no longer useful, Sarah cannot bring herself to throw them away, causing significant clutter and safety hazards in her home. 2. Causes of hoarding disorder. The causes of hoarding disorder are not yet fully understood, but research suggests that genetic, environmental, and psychological factors may play a role. People with hoarding disorder may have difficulty making decisions, have a strong attachment to possessions, or experience overwhelming anxiety when trying to discard items. Example: let's say you have a family member named John who has a hoarding disorder. John grew up in a household where his parents were constantly getting rid of things, causing him to develop a strong attachment to his possessions. As he got older, he found it increasingly difficult to part with items, leading to excessive clutter in his home. 3. Treatment for hoarding disorder. The treatment for hoarding disorder often involves a combination of cognitive behavioral therapy, medication, and practical interventions such as decluttering and organization. Cognitive behavioral therapy can help people with hoarding disorder identify and challenge their beliefs about possessions, while medication can address any underlying anxiety or depression. Practical interventions may include working with a professional organizer, setting goals for decluttering, and developing strategies for maintaining a clutter-free environment. Example: let's say you have a neighbor named Tom who has a hoarding disorder. Tom has been working with a therapist to develop strategies for decluttering his home. He has set a goal of decluttering one room at a time and has hired a professional organizer to help him sort through his belongings. He's also taking medication to help manage his anxiety, which has been making it easier for him to part with items. 4. Managing hoarding disorder in daily life. Managing hoarding disorder can be a lifelong process, and it's important to develop habits and strategies to prevent clutter from accumulating. Some tips for managing hoarding disorder in daily life include setting limits on acquiring new items, creating a designated space for belongings, regularly decluttering and organizing, and seeking support from family and friends. Example: let's say you have a coworker named Lisa who has a hoarding disorder. Lisa has been working hard to manage her condition, and has found that setting limits on acquiring new items has been helpful. She has also created a designated space for her belongings, which has made it easier to keep track of everything. Lisa regularly declutters and organizes her home, and has reached out to a support group for people with hoarding disorder to help her stay on track. Conclusion. In conclusion, hoarding disorder is a challenging condition that can significantly impact a person's life. However, with the right treatment and strategies, people with hoarding disorder can learn to manage their symptoms and improve their quality of life. If you or someone you know is struggling with hoarding disorder, it's important to seek help from a qualified mental health professional who can provide an accurate diagnosis and develop a personalized treatment plan. Remember, managing hoarding disorder is a journey, and it's important to be patient and persistent in working towards a clutter-free environment. Thank you for watching this video on understanding and managing hoarding disorder.